Computers, along with the information technology, are being introduced into hospitals to enhance the performance of the medical facilities that are dispensed. Good day, everyone. I am here to present my study, The Automation of Patient Information based on RAD model. Before we start, let's take a look on the short background of the author. I am Eileen Quilon. I finished Doctor in Information Technology at St. Paul University, Philippines, Tuguegarao City, Cagayan, Philippines. Currently, I am an instructor at the College of Business Administration and Accountancy at the University of Northern Philippines. I was able to publish two researches and also a reviewer and member of editorial board on the following journals as shown in the slide. Automated systems have much to offer in managing healthcare costs and providing the quality of care. The traditional medical record is paper based and has many identifiers, making it hard to find records in the physical filing system. The University of Northern Philippines Hospital plays an important role for both students and employees. The said hospital is responsible for safeguarding and maintaining and promoting the students' and employees' health. It is also responsible in managing the patient's records. The current manual management for patient information in the university hospital is physical record, which is mostly on paper, and storing that information itself is a difficult task for hospital as well as patient. It is in this case that system automation is needed, so the researcher paves way in the creation of the automated patient information. This study is designed electronically to maintain the university hospital's information resources. It is supported by a system that captures, stores, processes, communicates, secures, and presents information from multiple disparate locations as required. So, in addition, the system could assist efforts to moderate the costs of healthcare in three ways. First, to improve information could reduce redundant tests and services that are performed in response to the unavailability of test results. Second, administrative costs could be reduced, the ability to generate routine reports automatically. And third, the productivity of practitioners could be enhanced by reducing the time needed to find missing records or to wait for records already in use, reducing, if not eliminating, the need for redundant data entry, and reducing the time needed to enter or review data in records that have been streamlined to eliminate unnecessary information. For the objectives of the study, it aims to maintain the day-to-day operations and transactions in managing patients' records in the university hospital. Specifically, this study aims to meet the following. First, to identify the existing processes in managing the patient records in terms of patient registration, patient monitoring, and patient history. Second, to describe the features of the system. Third, to identify the security measures for the different users of the system. And lastly, to test the acceptability of the system. For the conceptual framework, the figure shows the developed model of the study. The researcher adopted the rapid application development as a software model to represent the structure of the system. It illustrates all those who are involved in each phase. On requirements planning phase, it involves the school administration and patient requirements. Under user design, it involves hospital administration, doctor, and hospital staff. On the construction phase is where the creation and development of the system falls into. The verification and validation of the system will be worked on the cutover phase. So once the system is done and will be implemented, the stakeholders of the university will be benefited as they will receive a quality of care that the university hospital may offer. The researcher perceived that the use of the RAD model would be appreciated for the development requirement of the project. For the requirements planning, the researcher conducted interview and identified the system procedures, problems, rules, needs of the university hospital. For the user design, the researcher formalized the system requirements and layouts for the system's essential parts in this phase. Also, it transformed and translated the requirements into a model or diagram to describe and understand the system. Moreover, the flow of data and activities is represented and designed. So the researcher used diagrams such as class diagram, the use case diagram, and entity relationship diagram. The system architecture of the study was developed to fully understand how the system should be organized and designed. Its overall structure as a set of communicating components. The users of the system can use various features and functions of the developed system by installing the automated patient information into the university hospital for the patients, doctors, nurses, pharmacists, and staff. In contrast, the admin can use and manage the system through the back end. For the construction, the automated patient information was developed using the Microsoft Visual Basic .NET programming language, and the MySQL Workbench was used as the backbone of the automated patient information. So for the class diagram of this study, it provides an overview of the developed system by describing the objects and classes inside the developed system and their relationship. So it runs several usages from modeling the domain specific data structure to the developed system's detailed design. The researcher used the use case diagram to define the core elements and processes that make up the developed system. And for the entity relationship diagram, this is to provide a specialized graphic that illustrates the relationship between entities in a database. So for the cutover, in this phase, every aspect of the system was validated and modified before and after delivery. Errors and faults are being reviewed to verify that the system can perform under expected normal conditions and abnormal situations. Results and discussions. First, under the features of the system. The developed system provides security on patients' records. Only those authorized personnel can access the system. The doctor functions as the admin of the system as he or she has the full access of the system and is responsible for the admitting and discharging for the inpatients, also in prescribing medicine, and if there is a need for a patient to go through a laboratory test. The admin has given all the privileges in accessing all the functionality of the system. The nurse and medical clerk can only add, update, and retrieve patients' information and add employees to the hospital. A username and password feature is provided in the system to ensure that an unauthorized person cannot access it. The developed system provides and performs the right processes in managing the patient records, such as storing new patients in both inpatient and outpatient. If the patient falls under the inpatient department or IPD, it allows the system to check on the rooms offered and the room rates. So there will be a unique IPD ID number that the system will generate. Also, updating the patient's details from its necessary information up to its health status and billing details. So this feature of the system allows the user to retrieve, update, and search for patient records easily, and it solves managing records difficulty. The hospital provides and generates patients' records when needed. It should maintain accurate information to enter the database. So, this function of the system allows the users to create lists of outpatients within the university hospital. Thus, it contains the following: the patient's last name, first name, the case number, category. This is where it appears if the patient had gone through laboratory tests and its medications. Also, the diagnosis, description per class, patient's doctor, and date and time. For the acceptability of the system, the table shows the automated patient information acceptability as to its constructive design as evaluated by the nurses, pharmacists, and medical clerks. As perceived by the respondents, the researcher determined that the system is of good design by evaluators as highly acceptable. And for the functionality of the system, it was perceived by the respondents that the automated patient information was able to meet the system's functionalities. The rating highly acceptable represent this. For the conclusion, the existing processes in managing patient record and patient registration, patient monitoring, and patient history were made manually. Patient registration provides security measures: add, update, delete patient records, dispense medicine, prescription, storing and managing of patient performance, laboratory tests, provides dietary table and generate reports was successfully designed. And lastly, ensures the developed system security. Different access levels were introduced: the admin, the doctor, and nurse. For the recommendation, healthcare professionals should adopt automated patient information as a standard medical and all other records related to patient care. An in-depth training has to be given to the hospital staff and all concerned healthcare professionals directly involved in the usage of the automated patient information for the UNP hospital to be oriented to the proper use of the developed system. And lastly, hardware and software specifications based on the system recommendation must be adopted for better performance. So before I end, I would like to extend my sincerest and profound gratitude to the following: Dr. Erwin F. Cadorna, the President of the University of Northern Philippines; Dr. Ferdinand J. Lamarca, the Vice President for Research and Extension and also the OIC Vice President for Finance and Administration; Dr. Eileen Cadorna, the Director for the University Research and Development Office; Professor Redentor Rojas, Coordinator for Science and Technology; Dr. Erwin Tolbe, the OIC Dean of the College of Business Administration and Accountancy; and lastly, the Organizing Committee of the Second Virtual International Multidisciplinary Conference on Current Research Trends for 2021. So, thank you.